everybody, welcome back yet again to another video. You've already seen the topic. I'm here at Destination Dallas setting up some cardio, and the discussion today is going to be over training while injured, quote unquote, or you're not up to your full 100% potential depending on what the injury is. And this particular topic is going over the piriformis muscle or sciatica or sciatic pain of the sciatic nerve. Okay, so I've been dealing with this for a while, probably about 10 years, when I was in high school playing golf. And my particular cause, it caused by multiple things. Okay, the etiology, be caused by simply sitting too long, having extensive pressure on the area, and I'll overlay some clips here of the piriformis muscle or sciatica pain. It's essentially pain in the buttocks area, whichever side, it could be left or right. So for me, it was pain in the left side, and it has rotated between both sides, and I think it started honestly from me sitting on my wallet for long durations of time in the car. I used to never take my wallet out of my back pocket, so that constant pressure while sitting kind of built up inflammation in that area. So that is the primary cause. Usually it can be, you can be born with it depending on the anatomical portion. The sciatic nerve can sit different ways under the piriformis muscle. It can be splitting the piriformis. It can be laying under it, laying on top of it. There are 4 different types, and that could have a result in the long term as far as your sciatic nerve pain. But I just kind of wanted to address it really quick because since I've been dealing with it for so long, I get the question a lot: should you train while you're injured, or should you train if you have a limitation? And that depends on the limitation. For me, I've been dealing with it a long time. That yes, yesterday I rested. Okay, it kind of flared up on me a couple of days ago, so I'm like, I'm just gonna rest. Now, what are some preventative things or things you can do, treatment options for this, before I discuss what I do? First option I recommend is stretching. The piriformis muscle, it gets tight, it gets inflamed, so it's essentially pressing up against that nerve. However, the sciatic nerve is anatomically positioned, so that's all relative, but stretching is number one. There are different stretches that you can do, and maybe I'll display some on the screen here, since I am on cardio machine. But stretching, number one. Number two, you can start incorporating some type of movement, activity. It all depends, because any type of movement or activity could exacerbate that pain even more. So maybe walking on a flat surface, slight incline, maybe 1 or 2 steps above on the treadmill will help, because you've got that constant motion going on an even path. Now for me, I don't know, I felt okay today, so I thought I'd do the stair stepper. But some type of movement. Number 3, and you can even move this one up, is exactly what I said: rest. Take the time, ice it, rest. There's different positions that you can be in to rest it, so it is positioned properly, not to be aggravated or exacerbated even more. So we'll overlay some pictures here as well. You're essentially laying down face forward with pillows under you. You want an even flat plane where your body is not sunken in, there's not extra pressure pushing down on that nerve. So that can be done. If you're sleeping at night, it's recommended to sleep on either side. Usually I like to, whichever more is comfortable, what I recommend is sleeping on the side that is not painful. So put pillows in between your knees and you're positioning yourself sideways with your knees up, almost like in a curled position. So those are 3 non-pharmacological treatments that I recommend. Now, the last resort, this is too painful and sometimes I have to resort to this, is to start incorporating non-steroidal anti-inflammatory drugs, or NSAIDs. Can be comprised of naproxen or Aleve, same thing, ibuprofen or Advil. Now, those are going to help with the anti-inflammatory response to that flare-up of the piriformis muscle. Now, most people might ask, well, I take Tylenol. Well, Tylenol doesn't have any anti-inflammatory effects, okay? So it's not going to work for what you need it to work for. So those are the 4 treatment options that I recommend. If you can get up, get active, first rest. If you can get up and get active, stretch, start moving it, get mobile. And then if that doesn't help, if you're just in agonizing pain, go ahead and incorporate those pharmacological therapy I just recommended, which is NSAIDs, naproxen, Aleve, or ibuprofen. Now, if you have any type of bleeding disorder, kidney disorder, be careful of incorporating those. First, anything that I recommend needs a thorough checkup from a primary care physician before you try anything, okay? Don't just, make sure you're okay to take these medications. Anything you're ingesting in your body, make sure you're okay from a health standpoint to take those medications or supplements that I recommend. All right, so hope that helped you out, guys. I'm gonna go ahead and continue. I'm gonna stretch after this, and it's supposed to be my leg day, but probably just do cardio stretching, maybe some abs, leave legs for tomorrow, rest it, see how it feels. But thank you guys for tuning in, and I'll see you guys in the next video.